Good morning, everybody. Welcome to another Mancoll Minute. Hope you've had a great week as we have. Well, things are really starting to get busy for this end of the year time. I think if you've come in to see me, you've heard from me how the last 3 months always really are the busiest. It works out well for people's schedule. Kids are back to school. The holidays are coming up. There's a little bit of built-in downtime. So people are really looking to get some procedures done and then sort of have the recovery. But the big question that comes up for everybody is, what does recovery really mean? So what I'd like to do is a series of these talks to kind of look at the different operations that I do and then tackle what's the recovery time. And so why don't we start off today with just liposuction. One of my favorite things to do, I'm getting ready to do a case here in a minute, and I tell people liposuction, in my opinion, is the easiest recovery with respect to the do's and don'ts. Because pretty much do whatever you want. It doesn't matter how much activity you do. It doesn't matter how you sleep. It doesn't matter, in my opinion, what you reach up to get, all the things I'm talking about for other restrictions. You're in a compression garment, okay? The main thing is you want everything smooth underneath it. So a lot of times we've got foam to help with that, to help smooth it out, or these belly boards or back boards that sort of keep the skin in the right position. And for me, I have my patients wear compression for 6 weeks. Now, it's sort of the 80-20 rule. 80% of people look at me at 6 weeks and go, oh my God, I got to get out of my compression. It feels so good. And 20% saying, thank goodness, I can't wait to get out of that. But it's important initially to get that skin to stick down to that muscle layer so you don't get fluid collection. So you're pretty much sleeping in it day and night for the first 2 weeks for sure. And then I really do recommend for another 4 weeks that you're wearing it, certainly when you're up and about. Then you transition, if you don't want to just give up compression, you kind of transition to less compression over a 2-week period. And then I think everybody's going to be, feel better if they're in some kind of compression while they're working out. And that will go on for however long it feels more comfortable. As I said, you can do whatever activities you want. I guess the biggest restriction I'll tell folks is I just don't want you to go to bed and say, I don't feel well, and not get out of bed for 3 days. Okay, I do worry about blood clots. I do worry about how well you're breathing. So I want you taking good deep breaths. I want you trying to hit 5,000 steps a day, divided every couple of hours to get all that in. And it's doable. I mean, the vast majority of people have no problems with it. It's just understanding it's okay to do that. Remember, we'll be using non-steroidals as well as some mild pain medicines to help you with post-op pain discomfort, so that's not a deterrent. And for the most part, not everybody's the same, so there's going to be a variation. I tell people it's the standard bell curve. The 1 week visit, it looks like they've been done for 6 weeks, and the 6-week visit looks like I did them last week. Okay, but most people fall in the middle. And then the final part of recovery, I guess that's really important, is to make sure you stay well hydrated and get good nutrition. Those things are all important to healing, especially the hydration. If you get dehydrated, you'll increase your risk of post-op nausea, you'll just increase your risk of DVT, you'll increase your risk of just feeling bad. So getting plenty of fluids in that post-op time is really critical to a successful outcome. So that's liposuction in a nutshell. Real simple, easy, not complicated from a recovery perspective. And I guess the final thing I'd add there, from return to work, depending on the kind of work you do. And for my patients, it's rarely more than a week. And I have patients go back even within a couple of days if they're sitting at a desk. And it's not so much pain discomfort that keeps you from being back at work. I think it really is more just a lack of energy, kind of feeling like your batteries run down. That just makes it a little bit harder for folks. And I tell people that right up front. Just expect that, kind of plan your day, plan your schedule when you go back that first week or so that you don't make it your busiest week of the year for the things that you can control. If you have more questions about it, don't hesitate to give me a call. Look forward to talking to you next week. Have a great weekend.